It's been a bad day. You've been in a bad car accident or experiencing chest pain. Fortunately, there is an emergency medical system built to respond immediately to your crisis. Now rewind. It's been a bad day, but this time it's due to a mental health crisis, like thoughts of suicide. The same emergency medical system that responds to chest pain also responds to this type of crisis and is less than ideal to handle it. Yet it is this system that responds to thousands of people in a mental health crisis every day. In general, everyone in a mental health crisis gets routed through an emergency department. There, a person in crisis often waits between 18 hours and 3 days for connection to mental health care. This approach is difficult for patients and wastes a lot of resources. But the Crisis Now model outlines a tested and proven alternative. A way to improve crisis systems across the country by expanding the options for those of us in a crisis, while reducing overall healthcare costs by creating a true emergency crisis service. And there are big savings in the justice system too, while dramatically improving the experience of the person and their family members. Drawn from current national best practices in crisis response, Crisis Now focuses on 3 components that help ensure an appropriate level of care to anyone in crisis. Component 1. A crisis call center staffed by specialists that coordinate all levels of crisis care. They evaluate the current crisis and can support and stabilize up to 90% of the cases they get. Those that need more, get more, with these hubs dispatching appropriate resources and then supporting those resources and finding the best solutions. Component 2. 24/7 mobile crisis teams that work in the streets meeting people where they are and for the majority, resolving their crisis right then. Dispatched by the call center hub, they lessen the burden on local police and reduce the stigma that some feel when a uniformed officer knocks on their door. Component 3. Crisis stabilization locations, which constitute the retreat model, can offer short-term care for people who need support and observation, regardless of their level of crisis. These programs operate 24/7 and are the right door to everyone in a mental health crisis, including those that may require involuntary treatment. These high-tech, high-touch facilities divert away from the emergency departments and jails while providing immediate specialized treatment. Police no longer need to decide between EDs or jail. The no wrong door approach reduces the time needed to handle these cases from hours to minutes and allows police to go back to supporting public safety, a role they're uniquely trained to do. Let's review the impact of the Crisis Now model in Maricopa County, Arizona, 4th most populous county in the US. In 2017, Maricopa County Police connected more than 23,000 people in a behavioral health crisis directly to crisis care, and those people were accepted 100% of the time. The Crisis Now initiatives saved the time equivalent of 37 full-time officers, reducing wait times in emergency departments for behavioral health patients by a total of 45 years, saving local hospitals and emergency departments a total of $37 million in avoided costs and losses, freeing them up to help the patients they're designed to treat, while routing behavioral health patients to a course of care that's best suited to their needs, and reducing Maricopa County's overall healthcare costs by an estimated $260 million, more than twice the cost of Crisis Now services. To learn more about how Crisis Now can make a difference in your community, go to crisisnow.com and download our white paper.